for folks listening, if they look left or right, odds are the community across the street is either already using Senior Sign or already using point-click care. And there's a mass of communities right now that literally before summer or fall is over could have a digital transformation take place with a move-in software that they adore connected to an EHR that they've come to love over years and be in a really, really great place going into their goals for 2026, increasing census, cutting down efficiencies, having a system that works flawless. I mean, between the two of us, thousands of buildings are already making this move, and it's probably going to be thousands more before the year is over.
Welcome to The Move-In, a senior living marketing podcast from Unlock Health, a full-service marketing partner for the aging services industry. Join us for candid conversations exploring the latest marketing strategies with the senior living community leaders and innovative solution partners who are moving our industry forward. Together, we'll build a community to build better communities. Have you ever had a potential resident or a family walk away, not because they didn't love your community, but because the move-in process was just too overwhelming? The decision to move into a senior living community is already emotional and complex for residents and their families, but when you add layers of paperwork, back and forth communication, and administrative delays, it can turn excitement into frustration. Hello, I'm Larry Williams, and welcome to the Move-In Senior Living Marketing. Today, we are talking about a crucial yet often overlooked part of the resident journey, the move-in experience. And it looks to be getting smoother thanks to the exciting new partnership between Point Click Care and Senior Sign. We asked Murray Mercier, the Director of Senior Living Solution Architecture at Point Click Care, and Kaden McKenzie, Director of Sales at Senior Sign, to join us and share insights on how this partnership is revolutionizing the way senior living communities handle move-ins, making it faster, easier, and stress-free for residents, families, and staff. In this conversation, we explored three key areas transforming the senior living move-in experience. First, we examined how a complicated move-in process can deter potential residents, turning excitement into frustration. Streamlining paperwork and logistics ensures a smoother transition and sets the stage for a positive resident experience. Next, we discussed the game-changing partnership between Point Click Care and Senior Sign, which eliminates administrative headaches by integrating a seamless document management. This reduces workload for staff, enhances transparency for families, and frees up time for more meaningful resident interactions. Finally, we looked at the future of digital transformation in senior living, emphasizing why embracing technology is essential for staying competitive. Automation not only boosts efficiency, but also enhances the human experience, allowing staff to focus on people, not paperwork. Plus, we teased exciting innovations on the horizon that will further improve senior living operations. At the heart of it all, this conversation reinforces one key idea. Efficiency isn't just about speed, it's about creating better experiences for residents, families, and staff. Let's jump into it. All right, we are on the Move-In Senior Living Marketing. I got Murray Mercier and Kaden McKenzie with us today. Murray, we just were introduced not too long ago. Kaden, man, you have to get tired of me because every time I get to see you at a conference, you're a go-to. I always connect and we get to share stories and everything, but just want to welcome I just want to welcome you both to the podcast because I know there's some exciting news and we wanted to really share, what's going on and how it's going to help the community. So before we go any further, please, Murray and Kaden, if you don't mind introducing yourselves. Murray, if you go first, if that's okay.
Yeah, absolutely. My name is Murray Mercier. I'm currently the Director of Senior Living Solution Architecture at Point Click Care. I'm a third-generation senior care professional. My grandmother was a nursing home administrator. My father was the CIO for HCR Manor Care for many, many, many years. I chose senior living because I didn't want to follow in my father's footsteps, but also because I really just appreciated how senior living has the opportunity to make its own choices for its residents, for its staff, for its community. And I was really drawn into that. So I spent the last 25 years striving to help support, make senior living a better place to live, a better place to work, and just more engaged and desegregated and just a great place to live.
Dude, I appreciate that. I feel like everyone who gets into this space has a story of how they got here. And I appreciate not only you explaining that, but also the excitement you have. So thank you for sharing with us, Murray. Kaden, you're up.
Yeah, I'm Kaden McKenzie. Thanks, Larry. I'm the director of sales at Senior Sign. So a lot of the operators have probably seen me wearing pink polos around the conferences that we're traveling to. I was an engineer before I got into senior living and got drawn over because it felt like an industry that could benefit a lot from technology, being presented with solutions that were tailored for what they needed. So even the software that they was using, it wasn't meeting their needs, or it was a poor fit. And so the move-in process was something that was really being left alone, that we could see pretty immediate results and smiles for, an industry that's full of a lot of great people. So it's hard to resist not coming over and, working with folks that always had a smile on their face.
Well, that's great. Well, speaking about the people with the smiles on your face, that's also you, my friend. So appreciate the energy that you both bring to this conversation, but at the same time, the community. And now that being said, let's roll out that big announcement that you kind of teased with me earlier, and why I asked you to be a part of this podcast.
Yeah, absolutely. Thank you, Larry. I'm going to cut right to it. Point Click Care and Senior Sign have entered into a partner-powered engagement, which links our two systems together more tightly, bringing new solutions and value add to that move-in experience in a senior living setting. There is so much happening when somebody is choosing senior living as their home, and we don't want the paperwork to get in the way. And so that's really what brought us here, and that's what brought Senior Sign and Point Click Care together to make this great announcement and linking our technologies together.
Man, I appreciate, again, I'm going to say the word excitement. I appreciate the bravado you had in that. I think you have a career in just announcements in general, Murray. That was pretty impressive. Yeah, I think you could be like announcing UFC fights and stuff. That was pretty good. So that's really awesome that, like you said, you don't want the paperwork to get in the way of these movements. And I think far too often it does. We have good decisions, good ideas, but man, sometimes paperwork just drives us crazy. I'm going through that right now. We're trying to set up some retirement, funds for my wife, but holy cow, the paperwork, and it just makes it where it's like, yeah, we'll get to it tomorrow. Yeah, we'll get to it tomorrow. But I can see how this definitely improves that experience, because we think about the resident experience. It starts at the move-in. It starts at that framework. Would you agree? Do you see the same thing, which is people are excited and then all of a sudden it just gets delayed just due to all of the contractual obligations?
Absolutely. I mean, to be honest with you, it can be the make or break on a yes or no of moving into the community. Let's be real here. Senior living success in occupancy and reputation, it relies on the people living in the community having a great experience. And again, that starts with the paperwork. These residents are looking to choose a community that they can trust to provide them with a better experience at this stage in their life than they're currently having. And let's face it, they're dealing with paperwork through Medicare, their insurance payers, all these different angles. So whether, it's somebody that's just preparing for their future of aging, or maybe they waited a bit longer and they've already reached the point of dependence physically, cognitively, or the one that most commonly gets left out, which is really socially.
Sure.
Maybe this person has been isolated and they're already suffering from loneliness and helplessness and boredom. At this point of move-in, it is critical to have clear communication, transparency, and as supportive a transition process into the community as possible. This sets the stage for the first year of their experience in your community.
Yeah.
I think Murray, to add to, and Larry, that the group that sometimes gets forgot about is the frontline workers that are at the community. They love giving tours. They love having their first meal with the resident. They love giving them their keys and walking them through their new home to live. And now they're inundated with these administrative tasks where they don't want that friction either. Sales and marketing wants to get back to hosting events and reaching out to the community and spending time with the residents, but they find themselves locked in their office, thumbing through paperwork, tracking down documents, being a pesterer of the family, right? Because they know they have to do that for a resident to safely enter and be covered, but that's not where they want to be spending their
Absolutely.
time. They want to take that if they can and get back in person.
So you mentioning making the process more efficient and taking that workload off of those that are in the community. And it makes me think about almost every conversation I have on each podcast. We speak about AI and how AI can make us more human. And I feel like this is the same thing, which is like, let's get away from these redundant tasks. And if there's a system that can take care of this, so we can focus on being people who serve people, that's going to put us all in a better space.
Yeah.
I think a lot of people, they hear technology or they hear some of the hot button phrases we use like automation, integration, auto forwarding, and they think that equates to lack of human touch. But I think what you were saying was more hits on it is those activities are currently manual, offline, no social activity. It's happening by yourself in a back office next to a printer or in front of your computer. And so if we can automate those things that already are low touch with residents, you're just freeing up more time for the actual human interaction, holding hands, sitting across, having a conversation, sharing a meal, the stuff that shouldn't be automated. And we have no desire to remove that piece.
Yeah, that's great.
Yeah, I think that's a good point. You know, AI is obviously the hot button term always, everywhere, anytime now. But, you know, when you think about what AI does is it pulls information from all locations and puts it in a place that helps you make a better decision, have a better result, no matter what you're doing, cooking eggs, all the way through to giving a better experience in a senior living community workflow experience. And that doesn't just have to happen through a chat bot, like, right? It can happen through APIs and systems connected to one another and speaking the same language to drive that efficiency. I want to take this down a road that's similar to this, though, and that's specific to, you know, senior living communities do not only contract for the rental agreement of the apartment, right? There's so many more documents and agreements on the services side of senior living, particularly in assisted living and memory care. But even in independent living, you're starting to see things like healthcare concierge. Perhaps they're helping to coordinate the logistics around a doctor's visit, or God forbid, the resident does go to the hospital. There's paperwork that needs to be in place so that that community can act on behalf of and in support of that resident's transition through healthcare. And the reality is, when you get to this age, you're going to interact with healthcare more and more.
Sure.
And I'm really excited about how Point Click Care and Senior Sign are working together to make that process more efficient, get everything in place without sitting in the back office next to the printer, like Kaden said.
Well, and so a question, as you're speaking about the continuum of care, and you know, there's so much that we have to think about, you know, as we go through this process. How much, you know, are the adult child decision makers? Are they, how much are they included in this process? And is this a process where you're able to get them involved? I'm sure that has to help as well.
Yeah, you know, if you don't mind, Kaden, you know, we talked about we've talked about efficiency and we've talked about experience. I think that the last critical pillar here is transparency. Yeah. And you're right. The adult children do care about what's happening to their family member living in your community. And so there needs to be a lot of trust between the adult child and the community that's offering and coordinating these services for their loved ones. And again, it just starts at that initial paperwork. If it's a pain in the butt to get the paper signed, what's it going to be like when I actually have to rely on this community to do that healthcare coordination for mom or dad?
Yeah, because I'm sure it's being viewed with the microscope, you know, from the adult child, you know, watching everything because they want the best for their mom, dad, aunt, uncle, grandparent, whoever that is. Kaden, you were going to say something. I think I jumped in your way.
No, you're good. I love that you guys are looking through things from the resident and from the family. I always just, with who I'm spending every day with, look at from like the sales and marketer and the operator and another friction point. Like, yes, we're trying to help the residents, but sometimes we also have to meet their family members and loved ones and powers of attorney and responsible parties where they are. Yeah. And oftentimes that is at a higher level of technology use, where the resident may be sitting in front of you, that adult child might be 9 states away. And as much as they want to be there in person, you know, we need to make sure that Point Click Care is where clinical can go and Senior Sign is where sales and marketing can go. But these folks who can't be in person, they need a portal where they can come in and have that transparency, and we can meet them where they are at the amount of, you know, human interaction or time commitment that they can give without slowing the resident down or the community's process down.
Yeah. And it's funny, is gotten more into serving the senior living community. And now that I'm in that sandwich generation where you're helping with your parents and also taking care of your children, myself and my friends, we're all kind of in this same place. And so having more of these conversations about, with my friends and their parents and how much their parents ask for feedback from their kids, and that's a big part of it. And all it takes is for the child at times to kind of throw something up saying, I don't like where this is going,
Yep.
to distract from from that process. And it's also made me think about, my wife helps provide some design services for like rental cabins, and her big thing is, if you walk in, if something doesn't look right, you're being judged at that point. Whatever you're seeing, you will judge it right or wrong based on that first interaction. I'm sure it's the same thing going through this process with all the paperwork.
I'm so glad you both brought this up, because to your point, there's so many things from a sales and marketing perspective that you have to do to not only guide a person to make the choice to move into the senior living community and convince them that this community is the right community for them, but physically. You have campaigns, tours, long sales cycles, physically moving someone from a house that they probably spent 50 or 60 years residing in. So getting an agreement signed should be nowhere near a point of frustration in that process. That should be reserved for more important things.
Yeah. Now, let me ask you this. Do you have any data or information that shows like how much this speeds up that process? Or, can you elaborate there?
The consistent is, we're talking to our operators and the folks that are on the front line, moving from either a paper solution or like what we'd call a generic off-the-shelf e-signature platform is half the administrative workload. So, and the administrative workload, I think a lot of operators will hear that and think like, well, you can't cut a signing down if people want to read through the contract. I agree. But communities are pulling together their own packets, either on paper or digitally, having to learn a system on how to build those, resending documents because they're not making them. They're trying their best to make it as easy as possible by tagging and flagging and highlighting and pre-filling as much as they can to make things easy for the resident. And all of that is building up on these 2, 3, 4 move-ins a month, 40 move-ins a year on a portfolio of 30, 40 buildings. And now we're talking hundreds and hundreds of sales and marketing hours that are literally going to just getting paperwork ready to then allow the resident to look through and start that signing. So if we can get rid of those hundreds of hours, and it's a click of a button to have a packet ready to go, a click of a button to get those signed and completed, and then all of that is whisking itself away into the EHR environment of point click care for storage. Like, we've alleviated the administrator, sales and marketing, the business office manager, and the resident is moving in thinking, this was a really good, first step into this community. Not difficult at all.
That's great. I appreciate that. You mentioned when you think about an organization that has 30 to 40 communities, this has to help, really enforce some corporate consistency across all communities. That has to make a big difference as well.
I was really lucky and privileged to get to spend, about 5 years of my life as a resident care director in several senior living communities. And I'll tell you, it was no strange occurrence to be sitting in the marketing sales office on a Saturday morning for over 4 hours, going back and forth from the conference room to the copy machine, licenses, signatures, copies of copies. So it's 6 hours of them sitting there with me before they even get to put a chair in the room. And so having that experience, I'm really grateful for this opportunity to work with Kaden and the senior sign team to bring these efficiencies to that sales, marketing, and resident care and wellness teams to their plate.
Yeah, that's great. Now, question for you, Kaden. When I was introduced to, you and Jared with Senior Sign, you had a great line, which is like, we're the DocuSign of senior living, right? And my question is, like, do you ever get any pushback from, the, potential residents of going, through digital means of signing instead of paperwork?
Yeah, not anymore. It's
okay.
like everybody in their and their great grandmother has a smartphone. That should
That's what, okay. And that's what I want to ask all the questions. So, one thing that I really appreciate about you, Kaden, and connecting with the Senior Sign team, y'all made it really easy for me to understand the advantages that you bring to senior living. You said we are the DocuSign of senior living, of senior living and aging services. Question for you: do you ever get pushback from potential residents about using digital means to sign these contracts, or how does that look these days? I'm trying to think of any type of hurdles that you all experience and how you can continue to move that, push that needle forward.
Yeah, Larry, I think residents, there's always a subgroup that's going to push back on anything that a community wants to offer.
Sure.
And so really about every software and offering that a community has being flexible enough to meet the resident where they're comfortable. So giving them an in-person or a remote signing option, or giving them a more old school that can be a pre-prepared, nicely typed packet that they can sign on paper if they so choose, and still making it easy for the community to capture those signatures and documents and get them where they need to go.
I love that. I appreciate that. Again, it's meeting people where they are in that journey. And I think that's an area that really the aging services has really evolved to, which is connecting people where they are. Murray, I was going to kind of get some feedback from you on that as well, if you don't mind.
Yeah, and I think in the technology world, we call those people laggards, which I don't know if I agree with that term, but nonetheless, that's what we call them. This is a key point. When Point Click Care started looking for a partner in supporting such a big life event transition for residents and staff and family members, we knew through trial and error that we needed to find a partner that was purpose built for the task at hand, which is exactly to your point. I don't get along with technology. I need an in-person option. I do get along with technology, and I'm halfway across the world. You need to be able to support my technical advanceability, right? Or whatever the right word is there. But Senior Sign was the clear choice because they built document management for senior living. And that's you could go with an Adobe, you could go with a DocuSign, but it just does not have the feature functionality that is needed inside of this specific workflow. We call it client journey mapping, right? It's like, what is the process of interacting with information for the resident, for the staff in this specific situation? Senior Sign did that, and they produced a technology that was spot on for the need.
That's great. And now, question for you: beyond, we think about the move-in process and making that more efficient and speeding that up. What are other ways that this partnership is helping to expand, like to address other challenges within, within senior living?
I would say that we're extremely excited about the value add that we're bringing in this initial integration offering. It's going to solve some real challenges in the community. I'm also excited to say, and maybe not putting all cards on the table, that we're already brainstorming additional value add further into the care coordination process. And I'll leave it there for now, only to say that you might see some more announcements later this summer.
It's a teaser. That's exciting stuff. I appreciate that, Murray. So thinking about what advice you have, we've spoken about the move-in process and really making that more efficient, and that's going to pay dividends. And, the word, the phrase compound effect, because like you said, Kaden, it seems like small advancements, but man, over time with many communities, with many sales directors, this is going to add up. What other advice do you have for communities considering a digital transformation for that move-in process, but they're hesitant to change from traditional methods?
Yeah. I'd love to give them maybe a couple steps that they could follow that feel a little bit more bite-sized.
Yeah.
Usually when people are worried, it's because the prep work or the groundwork they feel either hasn't been laid or is too difficult. So I always recommend just taking a look at your move-in paperwork in general and seeing, is it standardized to the best that you can on a home office, state, and community care level setting? No reason to have 39 separate leases if it can be, one per state. Get those templates down to 6. The next is getting them stored in one easy to pull location. Then any e-sign that you use, you're ready to deliver those to that company so they can build them for you. Most won't build them for you. I guess that's given a little too much credit, but we will. We'll build those templates. And then the last is finding the person in the company who's most dedicated and excited to a project like this, because to them, the project won't feel like additional work. It'll feel like a goal that they've had finally coming across the finish line. And every org has one. We just
for sure.
They are.
It's always big to find that champion who's going to help lead the way. Is there any type of audit process that they can look at if someone reaches out to, like, say, the senior assign team or point click here, that can help them kind of understand the lay of the land and guide them through this, almost like a digital transformation Sherpa, I would say?
Yeah, we've got.
Go for it, Kaden.
I know Murray on both sides. I know he's excited because he loves his success team as much as we love ours. But the companies are really coming together on both sides to make sure that pre-onboarding companies are comfortable and have a very clear plan in place for the steps that they need to take and the 90% of the workload that we're going to take off their shoulders. I think people are worried it's a bigger lift than it is.
Yep.
Yeah.
And then after that, being committed to providing as much training and support as portfolios need to drive that adoption long-term, regardless of turnover and changes to documents and changes to process, without consistently hitting them with, additional fees or slaps on the hand for needing more help.
Sure.
Right? We want this to be a successful transformation, and one that's not as stressful or as scary as I think a lot of people think it would be.
Change is hard. It's human nature just to stay with what we know, that term, stay with the devil, versus the one you don't. And just change overall is challenging, because we understand that senior living communities, everyone's so busy as it is, and to get that person who can lead the way. But like you said, there's ways to not make this difficult. It's a lot easier than what, I think people think it's going to be. So I appreciate your advice and feedback on that front, Kaden. So, all right. So what's the takeaway moving forward? Like, what's your goals as what's your goals for marketing and sales as you move into as we're into the spring of 2025 and think about from the time where we are now and going forward?
Yeah. So I would honestly go back to the start of the conversation where we started it on efficiency. We need a cooperative system that takes not a million years to deploy, right? 15 days to deploy, 10 minutes to use. I'm really happy about the mark we hit on usability of this initial value add feature function in our integration. It's amazing. It's super easy to learn. Number 2 is experience. Give people the technology deserving of the year 2024 and meet the residents where they are, which Senior Sign does in spades. And then 3 is transparency. You should be able to see what's happening with my loved one, with the paperwork, as a business, as a family member, as a resident. You should be able to see where you are in the process with complete transparency. So whenever I get asked about the future, my mind is on those 3 bullet points.
That's great. I appreciate that. Anything you want to add to that, Kaden?
Yeah, I think if I was going to be really bold, Murray can tell me if he doesn't, this is too much. But I think for folks listening, if they look left or right, odds are the community across the street is either already using Senior Sign or already using point click care. And there's a mass of communities right now that literally before summer or fall is over could have a digital transformation take place with a move-in software that they adore, connected to an EHR that they've come to love over years, and be in a really, really great place going into their goals for 2026. Increasing census, cutting down efficiencies, having a system that works flawless. I mean, between the two of us, thousands of buildings are already making this move, and it's probably going to be thousands more before the year is over.
That's exciting. That's exciting stuff. Go ahead, Murray. I catch you off.
The only thing I'll push you on is I'll say tens of thousands.
Yeah, that's fair. That's probably, that's fair.
The multiplier effect. Murray just took it to another level. So where can listeners go to learn more, or who should they contact if they want to explore this in more detail?
Yeah, if you're a point click care customer, reach out to your customer success manager and they'll be able to loop you right into the process. And then if you're not a point click care customer,
yeah, feel free to reach out to myself. You can go through seniorsign.com and be connected to a representative here. And we're happy to meet you again where you are in your operation and if Point Click Care customers wind up connecting with the Senior Sign team, we'll ensure that they're looped in with their Point Click Care account rep so that the process is flawless and everybody knows
I appreciate
how
that.
things are going.
Yeah, that's great, Kaden. So, and I'm very thankful that you both joined me today and really let everyone know about this big announcement. And I'll say real quick for me, we think about on the marketing and sales side, it's about lead generation, but an area that I feel like we don't address enough is the conversion side. And this is just as important. So just want to make sure that we think about the full, I'd say scale of the experience from lead generation, conversion to that resident experience. And this is a big part of it. So again, Kaden, Murray, thank you for joining us today. And I look forward to seeing you both at future events.
Yeah. Thanks, Larry. We'll do another 5K here soon at one of these get-togethers.
You always make me look bad, Kaden.
No, I trail you.
All right. Y'all have a great day.
Thank you so much, Larry.
Great stuff, Murray and Kaden. Thanks again for joining us. Here are 3 takeaways that I made notes of during this conversation. First, simplify the move-in process to increase conversions. A seamless move-in process reduces friction and keeps potential residents from second-guessing their decision. Second, use technology to free up staff. Automating paperwork cuts administrative burden, allowing teams to focus on residents, not forms. And third, enhance transparency to build trust. Real-time updates keep families informed, improving confidence, and creating a smoother transition. By streamlining, automating, and communicating better, communities can boost occupancy and elevate the resident experience. Thanks again to Kaden and Murray, and until next time, let's go make some meaningful connections.
Thank you for listening to The Move in Healthcare Growth. Add your voice to the conversation. Email the show at themove@unlockhealthnow.com. Follow us on social media and stay up to date at unlockhealthnow.com. Also, be sure to subscribe wherever you listen to podcasts so you never miss an episode.